But we have one of the candidates here, and Daryl's going to introduce her.
Hello. First of all, I'd like to thank all of y'all for showing up. This is very important. And now I want to say something. When I looked on some of the pages about Dr. Eck, there's like Dr. Eck. I was like, who is this Dr. Eck? And I talked to Barbara Gonzalez. She told me everything. You know how Barbara is. She's radical. She's radical. But she loves America. And if Barbara loves America and she tells me about Dr. Eck, I'm sure Dr. Eck loves America. She loves New Jersey. And it's so important that we support, especially a woman candidate. Definitely is important. And I, as myself, I ran for U.S. Senate not once, twice, but 3 times. And I'm the first person from Trenton to run for United States Senate. So I definitely understand it is hard, it is tough, it's a battle, and I definitely support you, not the other person, other candidate. I don't want to say it, person. But I think it's important that that people, when they talk about you, they say nothing but good things. It's important how you work in the community, definitely working with poor people, people that are struggling. That's important. We need candidates that understand things about everybody, and who has been working in the community, helping, fighting with health care. And she's against Obamacare, so I know she's all right. And it's so important that we support her. And it's important, never know, there's a governor's election coming up. We get that started. Oh yeah. Daryl for governor. No. I can't do it no more. But it's important that, the next election coming up also is the Senate election. That's 2014? 2014. And then there's the governor's election, I guess, 2017? 16. Governor's election. But it's important that especially we get a female governor that understands poor people, working people, and understands freedom and liberty. And so I would like to thank Dr. Eck for showing up. And I called the other candidate, and I told him who I was, there's some issues between me and him. And when I talk about freedom, you talk about liberty, only candidate you can mention right now for Senate is Dr. Eck. So I'd like to thank you for showing up. And ladies and gentlemen, Dr. Eck.
Thanks so much. It's a pleasure to be here. I would like to be the first woman senator from the state of New Jersey. The preamble to the Constitution talks about we, the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our posterity. That last phrase has really caught my attention. Because are we doing that right now? No. Has our federal government gone astray?
Yes.
The Patient Protection and Affordable Care Act, probably the most ridiculously named law I can think of, because if you take every word, they're wrong. And let me quote from a colleague. The federal government will be defining services, setting standards, establishing committees, calling for reports, deciding who gets in, who gets out, what they get, what they don't, even getting into the teaching of medicine, and all the time imposing a federally administered financial budget on our houses of mercy and healing. That was Dr. Edward Annis in 1962. The government was proposing the King-Anderson bill to take care of the poor and the elderly, but he further warned that these two programs, Medicare and Medicaid, would be the forerunner of a different kind of system of medicine for all Americans. The King-Anderson crowd intends to take us all the way down the road to a new system of medicine for everybody. Is that securing the blessings of liberty?
No.
It is not the job of the federal government to give people personal benefits, to take from one citizen and give to another, even if it sounds kind and compassionate, and even if it starts out well. Bankrupting the citizens and threatening our economy is not securing the blessing of liberty. And the federal government, as there are more and more cost overruns, can only respond by clamping down and taking away more of our liberties. Look at the IRS scandals. Certain groups, certain ideas are given special scrutiny if they might be opposed to something the government might want to do. The IRS wants to administer Obamacare and send swarms of officers to harass its people and eat of their substance, as I quote from the Declaration of Independence. Then you got the NSA scandal. Personal emails are being corrected, all this private information. Well, isn't it ironic that these two phony scandals happened at the same time, and that they combine two elements that will form the data hub of Obamacare? Our personal records and our medical records and our financial records will all be scrutinized in this. And the absurdity of Obamacare is striking. The Obama administration wants to spend $700 million to promote the $2.6 trillion health plan, despite the fact that $23 million has already been spent and has not convinced the American people that it's going to be good for them. In fact, the IRS agents that are being committed to oversee this plan and to make it happen do not want to be forced to enroll in it. And also the government, the Congress and its staff does not want to be enrolled in it. And the administration is going to take 175,000 what they call navigators. We'll each get 20 hours of training so they can help people fill out the forms that are going to have up to 1,000 questions to see who qualifies for subsidies. And there's not going to be enough time to do criminal background checks on these navigators. An important point, since these people are going to have access to the federal data hub, which contains the medical and financial records of us all. And the federal data hub has not been tested or secure, and it's going to be a veritable free-for-all for hackers and thieves. And there's not going to be any verification requirements, so that people who sign up for the subsidies that could lie about their income, and it might cost the taxpayers a whole lot more than we thought. Well, what could possibly go wrong? It's almost laughable to think that they think that this is going to work. And it's time to repeal Obamacare before it's a train wreck for all. And I was listening on the radio, and Larry Kudlow was saying, well, boy, once it gets to a certain point, you're not going to be able to stop it because the people are going to clamor for it because they think that they've got something good. We've got to convince people ahead of time how bad it is. We cannot continue to spend $1.40 for every dollar we take in, and this is just going to make it work. Well, I believe I am the only candidate of the 6 who are running who has any practical solutions to at least one of the giant entitlement programs in America, and that's the Medicaid program, because I've lived the solution. Currently, a full $13 billion is spent on Medicaid in New Jersey. It's a third of our budget. And it only pays doctors enough to file the claims. So at the end of the day, the doctor's not getting paid. So when my husband and I, he's also a physician, when we finished our training, we started a medical practice in Piscataway. Learned early on we couldn't afford to enroll in Medicaid, but we did not want to abandon the poor. So we were able to start a non-government free clinic, the Zarephath Health Center, 10 years ago. Volunteer doctors and nurses have logged in 30,000 visits in that time. We see 300 and 400 patients per month. We're only open 12 hours a week. We're extremely efficient. And can you imagine how many we could see if we were open 80 hours a week? Well, we get to know these people. We hear their stories. We care about them. They don't have to fill out long forms to qualify to be there. Just tell us your story and we'll help you. We don't provide insurance, but what we do provide is medical care when they need medical care. and medicine when they can't afford medicine. And the people are very grateful for the help we provide. You see, I'm not a community organizer, I'm a community caregiver, and I can show a better way to care for the poor. And we've learned that poverty is temporary most of the time. People, they're out of work, or they're single moms and the kids are growing, and it's just a temporary thing, and the lot can improve. They don't have to be trapped in a government program. We see prisoners who are released from prison and have no place to go. They can't get a job because they're considered felons. And then we see young people just out of college with a whole lot of debt, and they can't pay for medical care. And single moms with sick kids and diabetics, we give them their medicines, we give their medicine for high blood pressure. We see people from as far away as Newark, New Jersey, and the people can't find similar care in their own city. And while the mayor of Newark is busy making speeches and making $1.3 million giving his speeches, free people cannot remain free and be forced to pay for a bloated government that wastes their money. My husband and I have raised 5 children in New Jersey, and we see that they have a harder time than we did growing up because life has gotten harder. We're not handing them a more prosperous America. We're overtaxed, we're overregulated, and I believe I have a real solution. It could change the way we practice medicine, and it could relieve the taxpayers of the huge burden, and it would be better for patients and physicians. Now, how could argue with that? And so we have a law that's been introduced, bipartisan support here in New Jersey, that would do just that. Have doctors willing to provide care 4 hours a week in a non-government free clinic, and then have the state simply protect us from medical malpractice in our private practices instead of trying to pay us. If the state would do that, everyone would win. The patients are so grateful that minorities and Hispanics have signed up to vote for the first time in their lives because they see hope when they found out that I was running. Now, talk about a good way to improve race relations. We need more liberty, less government, smarter tax system, more prosperity. People need hope. And let me tell you, more government programs do not provide hope for the people. It's a trap. I went to the NAACP meeting last week, and I spoke with them and told them that I'm a Frederick Douglass Republican. Like Frederick Douglass back, you can tell me over there, who was Frederick Douglass? He was a freed slave at the time of Abraham Lincoln, and he believed in the Constitution, he was pro-life, he believed in smaller government and personal responsibility. Those are the 4 tenets that I think we can convince every American is the best way to live, the best way to be an American. And the key is we want to get our people back on their feet so they can be self-sufficient. So that is why I'm interested in running for the U.S. Senate. I want to repeal Obamacare, provide positive solutions, and statewide, I want to relieve the states of all the strings attached from the federal dollars that come back. That doesn't make any sense. We send it there in the first place. Why do we need all these strings attached and beg to get it back? Same thing with education. We just don't need that. Children need to have a backpack full of their tuition, and then they go and pick the best place to go to school. Parents love the kids the most, and they know the best where the kid can do well. Finally, if you do away with the yoke of oppression with the pointing finger and malicious talk, and if you spend yourself on behalf of the hungry and satisfy the needs of the poor, then your light will shine in the darkness, and your night will become as noonday. Thank you. August 13th.
And Lonigan says she was a one-issue candidate. Isn't that something? Isn't that something? I said, she should be our next United States Senator. We have to do all we can. We have to support her. I was an independent, and when Barbara told me about her, I switched and joined the Republican campaign. Yeah, so you will get my vote. Tuesday, right? Tuesday, you will get my vote. Then I'll switch it back over to independent.